Are you having trouble losing weight? Do you want a better night's sleep? Or do you need more energy? All of those things may be that your hormones are out of whack. Dr. Roz joins me now with information that can help you balance them out. I know a lot of people talk about this. What's going on? What's the case?
Well, the case is we all want a better quality of life. We want to have that energy. We want to still be vigorous. And so when you have those symptoms of hot flashes or night sweats, those are very common things that women encounter. But when you go to bed tired, you wake up tired, you can't sleep, you have no libido, how can we fix that so you can still be vigorous and have fun and still enjoy life as you age and as your hormones decrease?
Now, how many people, you see a lot of patients do a lot, is this a big problem for a lot of people coming in, or do they find that once they go through the process, they're like, well, I'm really not a candidate?
Well, actually, it's a huge problem, and a lot of times I uncover for the patient because they don't know what's going on. They figure, well, if I'm not having hot flashes or night sweats, is it really my hormones that's causing the problem? And when we get down to it, we find out, yeah, it is. And I do some studies and look at their levels and fix it, and they feel fabulous.
Really?
Yes.
So all these things, like you say, getting a good night's sleep and waking up feeling, I go to bed and I don't know, I try to get 8 hours of sleep, but I don't always feel well rested either. So it's really something that a lot of people can identify with.
Oh, absolutely. And there's a lot of things that have a factor in it as well, not necessarily your estrogen and progesterone, testosterone. Those are things that we commonly look at, but cortisol plays a huge factor.
Okay.
That's your stress hormone.
I've got some of that.
Yeah.
Well, let's talk about people that might be a good candidate for hormone replacement therapy.
Well, our hormones start to change as early as age 25.
Okay.
I mean, that's what regulates our menstrual cycle, PMS type symptoms.
Sure.
But as we go through menopause, the average age is 51 plus or minus 3 years. Your estrogen, progesterone, testosterone, those levels are decreasing. And so it's putting those back, giving you those hormones back. So candidates for that, or anyone who's going through problems with sleeping, energy, hot flashes, night sweats, no libido, crazy bleeding, they're all good candidates for it. There are some contraindications to use it, so not everyone can take it.
And I see up on the screen there, tired of being tired, you really want a better night's sleep, things like that. Anything that really, if you've got something going on, you should kind of come check it out. What about people that are not good candidates? Because, some people just, maybe they're not sleeping well. Maybe they're doing all the right things. What are some things that show you that you are not?
Well, if you're, not everyone's a candidate for hormone replacement therapy. A patient who's had a prior history of breast cancer is not a good candidate.
Okay.
Or a patient who's had stroke in the past, they're not candidates.
And why not?
Because there could be an increased risk in having recurrence of that, and so you don't want to give hormones to that patient.
I see.
Yes. And so there's alternatives, whether it be herbal medication, there are some antidepressants that are used for that. So there's other techniques or things that you can do for those patients so they can still, too, enjoy a good quality of life.
And that's really what it's all about, isn't it?
That's what it's all about, absolutely.
And talk about some of the alternatives to hormone replacement therapy.
Well, there's herbal medication. Black cohosh is one of the more common ones that you see. There's a lot of different herbs out there that are available that can be used. DHEA is one of my good, well, that's not necessarily an herbal medication, but it's a good one for libido. It's one of my favorites to use for patients. Fenugreek is another herbal medication that you could use as well. There are some patients who get a great response, believe it or not, to acupuncture.
Oh, really?
Yeah, so there are some alternative things that you can do.
I've never done that before. It always kind of freaked me out, I'm not going to lie.
Yeah, all those needles all over you.
All those needles. But I think it's interesting. And you have a newsletter that you do, a website, all kinds of things that you recommend and read up on that you can really help people with all of the different alternatives or hormone replacement therapy.
Absolutely.
Yes. Well, we always are happy to have you here. And some information there. Obstetrics and gynecology, you can check out Dr. Roz at drrozmd.com. Right there at Sycamore Hospital, which is great, very conveniently located for if you need to go get the acupuncture or anything else done there. Dr. Roz, thank you so much for being here today.
Chief Meteorologist Brian Davis.